Dr. Glenner was a world-renowned research pathologist. He actually discovered the beta amyloid protein, which, by most considerations is the hallmark of Alzheimer's disease. Dr. Glenner and his wife, Joy, co-founded the Glenner Centers, which was really considered the first Alzheimer's-specific day program in the nation in 1982. And it was really born out of the need of family caregivers, one particular that contacted Dr. Glenner in the middle of the night, who was contemplating taking his wife's life, who had Alzheimer's, and his own.
How do you balance just honoring George Glenner's legacy while you push for new ideas and change? That's rare. Like, some people just so venerate the past that they don't move forward.
My responsibility is to take those things from the legacy, right, and bring those to our team now, and assemble a team, as we talked about, that shares that same passion, but at the same time challenge individuals. I like to refer to myself as the gap guy. I try to figure out, things that are, kind of in the gap. It's an incredible mountain to climb, but we're all on the same mountain. Let's just, kind of help each other scale that mountain so we can help more people. I mean, isn't it? And I know it's kind of a rhetorical question, and I try to say it, to my team, but it's really just about helping people.
There's so much synergy left on the table in healthcare because organizations compete instead of collaborate. That just hit me like a lightning bolt. And we believe in collaboration. We put it in our name, Teleos Collaborative Network. So why do you think collaboration is so rare in healthcare? And what do you think it's going to take for us to shift that dynamic?
And I just think it's going to take more dialogues. And I know I referenced that earlier, but I think it's going to take finding opportunities for people to really understand that, competition, while I do get it, like I understand that, that is part of, business 101. More than anything, organizations can support each other, and there is plenty left to do. And I think that's what strikes me every day.
Welcome to our crossover show with Anatomy of Leadership and TCN Talks. Now, here's our host, Chris Como.
Hello and welcome. I am so excited today. Our guest is Scott Tarde. He's the CEO of the George G. Glenner Alzheimer's Family Centers. Welcome, Scott. It's so good to have you.
Thanks so much, Chris. Thanks for having me. I'm excited to be here.
Yeah, absolutely. I'm going to read from your bio, and then I want to see if you feel like I left anything out. So Scott Tarde is a licensed nursing home administrator, as well as a residential care facility for the elderly administrator. He's been the CEO of the George G. Glenner Alzheimer's Family Centers since 2015, and prior to that, he served as a volunteer member of the Glenner Center's Board of Directors from 2013 to 2015. In fact, I was thinking, Scott, when I read that, I'm seeing more and more like board members getting recruited into CEO roles. Never thought about that as a talent pipeline before, but I think that's becoming a little bit more normal.
Mm-hmm.
Scott has an extensive operational background in multi-site management of skilled nursing facilities and, of course, assisted living communities. The original Town Square Immersive Reminiscence therapy design concept for individuals with Alzheimer's disease and related dementias, ADRD is the actual abbreviation, and Glenner Care, which is actually trademarked, the virtual support service for individuals with ADRD. Those are Scott's innovations, and we're going to be able to talk about those hopefully. Scott graduated from the San Diego State University with a degree in psychology. So, Scott, anything I left out you'd want our listeners to know about you?
No, Chris, I think that's plenty, but thank you so much. I appreciate it.
Well, I did tell you I was going to ask you this question, but what is your superpower?
And I love that question, Chris. I think when I think about superpowers, I think of, from my standpoint, is trying to build superstar teams. I think that's one of the things that I share, with my team now, that it's really about, figuring out ways to put people who kind of do their best work together, find things that they're passionate about. So if anything, I've been very fortunate in my career to be able to discover, if you will, individuals that have that passion and put them together.
That's so cool. You and I share that passion as well. I always love that. One of my heroes was Leslie Groves. A lot of people didn't really know who he was till the Oppenheimer movie, but he was the general of the Manhattan Project. He literally had rocket scientists working for him, and to get those people working together. So I always kind of felt like he was behind the scenes. Most people don't know who he is, but some incredibly brilliant people. And depending upon what your version of history, maybe one reason why we've not had any horrible wars and et cetera, et cetera. So I love that example. Well, let's jump in because I have a lot I want to ask you about. The Glenner Centers really pioneered this concept of adult day services for individuals with Alzheimer's and dementia. How does your model differ from maybe the traditional memory care or home-based support? And also, if you could weave in, what kind of outcomes have you guys seen for maybe patients and their caregivers?
Yeah, I think the thing, Chris, about the Glenner Centers is that it has really an unparalleled origin story, right? So Dr. Glenner was a world-renowned research pathologist. He actually discovered the beta amyloid protein, which, by most considerations is the hallmark of Alzheimer's disease. And so if you think about an individual who has obviously this incredible brilliance and passion for research, discovering this kind of critical piece of Alzheimer's disease, essentially being well known in the community for his work and being called upon to find ways to support family caregivers. So it's this really interesting kind of what you wouldn't think of kind of a parallel, but it ended up being so, where Dr. Glenner and his wife Joy co-founded the Glenner Centers, which was really considered the first Alzheimer's specific day program in the nation in 1982. And it was really born out of the need of family caregivers. One particular that contacted Dr. Glenner in the middle of the night, who was contemplating taking his wife's life, who had Alzheimer's, and his own. So we know that that's a all too often, heard story of, overwhelmed family caregivers. And, obviously a cry for help. They were able to stop that from happening. And really the next day, they went on this incredible journey of developing the Alzheimer's Family Centers, obviously to support individuals with Alzheimer's disease and related dementias, 40 plus years ago, but really to support family caregivers to truly provide that respite. Not necessarily residential placement, which is totally fine. There's a time and a place for that, but really being able to support family caregivers so that they could keep their loved ones at home longer and provide that support and care and education and knowledge that really family caregivers are looking for.
That is so cool. And I mean, you kind of alluded to the outcomes, but is there other outcomes that just paint the picture of your success that would be worth sharing?
Well, I think, more than anything, when you talk about outcomes, when it comes to individuals living with dementia, you're talking about having an opportunity to engage and socialize in ways that you're just not probably going to get at home, as wonderful as family caregivers are. Having an opportunity to go into a kind of a congregate setting and be able to connect with peers and engage in activities. I mean, we know, Chris, family caregivers are amazing, but they're doing it 24 hours a day, 7 days a week. They have their own lives to live. They didn't necessarily know that they were going to become family caregivers, right? Especially when you're talking about spouses, adult children, things like that. They've obviously have their own obligations and responsibilities. So to be able to provide an environment that has these types of impacts, those are the outcomes that I think, we're most interested in seeing. Obviously, supporting the individual with dementia, clinical outcomes, reduced falls, things like that. Those are all very important. But interestingly enough, it's those components of social engagement that I think are really the most valuable.
Well, let's go more into that. So the Glenner Town Square model, if I understand it correctly, you correct me. So it recreates like a 1950s setting, and the idea is it's triggering probably long-term memories. How did you find that approach? What inspired it? And then I think is the term the power of reminiscence is like maybe a coined term, like how that helps in dementia care?
Yeah, absolutely. So a couple components, Chris, to consider. So if you kind of go back in time about 10 years, I had come across through my daughter, who was in 5th grade at the time. She's now, almost 21. But she went to a place called BizTown. And BizTown's here in San Diego. It's put on by Junior Achievement. It's a little city inside of a building. Obviously has nothing to do with dementia, nothing to do with the 1950s, 1960s, but very inspiring, right? Because the environment, I like to say environment matters, space matters. And so she came home raving about it. And so myself and one of my colleagues went to see it. And really the rest was kind of history. We, from there kind of went to work. I sketched out what I thought would be an environment that consisted of multiple storefronts, things like a movie theater, a diner, a museum, a library, a barber and beauty shop, a little blue house, which is reminiscent of our original center, a pub, places that, people would go to in kind of, Main Street USA. And I think from there, things moved fast. So we were able to create this environment that really focuses on where people's strongest memories are. Chris, most of our participants are in their early 80s, folks that come to see our center. So if you kind of do the backwards math, reminiscence therapy says that people make their strongest memories between the ages of about 10 and 30. So we wanted to create an environment that was reminiscent of where their strongest memories are. So again, that math kind of computes to the 1950s, 1960s. Now, I will tell you that people always ask us, right, well, what happens in the future? And until, dementia and Alzheimer's are, eradicated from the planet, which we hope will, happen at some point. I always say that my town square is going to need a Blockbuster and a video arcade, right? So, things will be updated in the future, but the impact that these storefronts have is really incredible because they are so powerful to individuals because they are familiar to them.
That's incredible. I think I mentioned this to you the first time you and I met. I had my first sabbatical in 30 years last year, and my field trip was to a good friend, the Center of Hospice in South Bend, Mishawaka, Indiana, and they have Milton Village, and it's exactly what you described. You and I were talking in the green room. The place in Netherlands that had the dementia village inspired, right, some of this idea as well. Is that correct, or maybe is it more incidental than actually directly correlated?
You're right. It was incidental. I was definitely familiar with it. You're referring to De Hoogeveen, which is in the Netherlands. In fact, I've been in the same place at the same time with the co-creator of De Hoogeveen. His name is Eloy Van Heel, and I think incredibly innovative. Now they are now I've not been there, but they are a residential facility. They have some really unique and innovative components, including like a dining room that's shared with the community as a whole.
Wow.
So some really unique things that, maybe are more Europe specific than we would find in the United States. But to your point, I mean, love seeing these models, love seeing things that, kind of, break through some of these kind of barriers of traditional care, because I think people are looking for different options.
Yeah, that's incredible. My favorite memory so they kept telling me they had a surprise for me. So I got to go to Milton Village on my field trip on that last day, and they were kind of secretive. And so long story short, what I got to witness in Mishawaka, South Bend, is where the Studebaker Museum and when they manufactured Studebakers. So they had a garage and they were delivering a Studebaker for the dementia participants to be able to tinker with. And I got to take a really cool picture in the convertible Studebaker. And so that was just super cool. Made a great memory. Who knows? Maybe that'll be a memory for me many, 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 many years from now.
Absolutely.
So obviously incredible ways that you're supporting these patients that are dealing with dementia. How about the caregivers? Like, are there ways that obviously having that service is an incredible support to them, but are there other ways that you sustain them in their caregiving journey?
Well, it's interesting that you mentioned that, Chris, because I think my journey has been, over almost 30 years, serving individuals with dementia, family caregivers. So I like to refer to myself as the gap guy. I try to figure out, things that are, kind of in the gap, because there are so many wonderful organizations doing so many wonderful things. And I really don't want to duplicate services. I want to complement services and find those synergies. And I'm always really passionate about that. And one of the things that we determined was that there really was a missing component outside of these centers, if you will. So yes, family caregivers bring their loved ones to our centers, have that respite care Monday through Friday, 8:45 to 5:15, great, right? But what about all the other hours of the day? Right? So in 2020, right before, interestingly enough, the pandemic, we launched a program called the Glenner Care. And so Glenner Care is designed to be a virtual dementia care service, really powered by social workers. And the goal there is to avoid unnecessary hospitalizations and emergency room visits. And the way we do that is we focus on upskilling family caregivers. And so what I mean by that is we're working with family caregivers in times of non-crisis, if you will, to make sure that they're better equipped so that they don't have to go to the emergency room, that they don't have to go to the hospital or an urgent care. Again, wonderful resources, not really appropriate for individuals with dementia. It's just not, for so many reasons. Hospitals do incredible work, but they're not designed to deal with individuals with dementia. They're designed to save lives and deal with emergencies or more chronic long-term conditions. So this has been incredibly impactful. One of the things that we've seen, and we were talking about outcomes, is we've seen that reduction in hospitalizations. We've seen that reduction in emergency room visits. And we're really figuring out ways to better support family caregivers, which quite frankly keeps their loved ones in their home longer. And I think that extends the runway to avoid, let's just say, premature residential placement. Again, wonderful partners in assisted living and in nursing homes, but reality is if we can avoid that or at least prolong staying in the home, I think most people would prefer that. I think even professionals in assisted livings and nursing homes would say, hey, yes, we're here, but we're here when it's right. And so I think the same thing is true with a program like the Glenner Centers and a complementary program like Glenner Care.
Wow. So do you have people that maybe just partake of the Glenner Care, but they aren't necessarily in your adult daycare, and then vice versa? Or is it always like a complete package?
We've done both. We've done actually some pilot programs for Medicare Advantage plans, which has been very, I think, interesting in a lot of ways. Great outcomes, but also trying to figure out how to complement managed care plans, which, they have, their complexities and they have their own kind of focus and program. So again, trying to figure out the best synergies between our organization and managed care. So we've seen good outcomes there. And then of course, we include that in our enrollment in our program. So that's an automatic kind of benefit, if you will, of attending the program. And so we'll give families a little time to acclimate, and then we'll start working on upskilling and supporting them virtually as well.
Okay. Man, this is just so innovative. I was, when I got back from my sabbatical last year, my second son works in hospice. He's in his young 20s. And he just looked at me and said, Dad, I'd love to be part of that, something like that one day. And because he's his title is a care advocate. So you imagine as a hospice care advocate, he sees the gaps in the system. I love your term about kind of the gap filler.
Yeah.
And I already kind of was pretty excited about what you're doing, but seeing it through a young person's eyes who's out on the front lines of healthcare, I think you're onto something incredible. So have you found ways to scale this thing? How do you replicate it, bring it to other communities, and what are the challenges and opportunities that maybe you are seeing, or maybe you're foreseeing that you're going to be dealing with doing that?
Absolutely. Well, I think when it comes to scaling, it's been an interesting journey, but exciting at the same time, because, with a nonprofit organization, there are inherent challenges of scaling and, capital acquisition and things like that, which we understand. I mean, that's part of the landscape of running a nonprofit and driving, a mission, which is to keep rates and services as affordable and accessible as possible. But at the same time, in all reality, it takes money to bring these programs to different communities. So we were very fortunate to partner with an organization that was really innovative in its own approach to home care. And that organization is Senior Helpers. And Senior Helpers is a very large non-medical home care company. Understand they have like 400 locations in 45 states. And so one of my board members, chair at the time, was a franchise owner of Senior Helpers and introduced me to the CEO of Senior Helpers, Peter Ross, who became a fast friend and a wonderful partner. And his vision was to try to create a franchise model of Town Square. So we did that. back in 2018, 2019. And so now Town Square exists as a franchise as well. So we do our locations, obviously, in San Diego, and now there's franchise opportunities across the country. So there are now 11 locations open and operating. So everywhere from Florida to New Jersey, Texas, Washington State, South Carolina. So it's exciting to see these locations opening. But you know what's the most exciting thing, Chris, is, Scott doesn't know anything necessarily about those different, cities and areas. I've traveled through some of them, obviously, but we know all the healthcare is local. And I know that's a cliche, but it really is true.
I agree.
But the reality is that, to have independent owners and operators that, want to bring this to their community and do it through a franchise model so that there are those standards and there are that knowledge and know-how. It's been, to me, goosebump amazing because we've been able to see the replication of Town Square in these communities through that model. And, if you would have asked me in 2017, 2018, when Town Square here in San Diego opened, how many we could have, I couldn't even tell you, Chris. I mean, it might have been one more, two more, because it was really a labor of love for our organization to open just one. But now I can honestly tell you, I mean, it could be 100, it could be 200, locations. Wow. And that's the game changer because most day programs don't really exist specifically for Alzheimer's disease, don't exist in most communities. So that's what, fuels my passion more than anything now is to see the legacy that the Glenner Centers have, be able to be expanded throughout the country.
That's incredible. Have you gotten cross-pollination, Scott, where all of the different locations, the reason why I asked that question, so our Telias Collaborative Network, we have 24 hospices now all over the country. And maybe the thing that has probably made me just smile the most is watching the cross-pollination of these different programs, sharing with each other. It's like that essence of synergy, right? Your 1 + 1 is equaling 5. Have you seen some of that, or is that still like the early stages part for you guys?
It's the perfect question, Chris, and it's definitely happening. I mean, you're seeing owners speak to each other. You're seeing the Town Square franchising kind of support team, if you will, sharing best practices. Reaching back to the Glenner team and thankful to have the opportunity to share things over our last 40 years of experience. So yes, it's the model, but then it's everything else, right? I mean, because the magic really happens, within the centers, and they just become, a place where family caregivers can come and get the support. But more than anything, Chris, and I know you appreciate this too, it's the sense of community. It's the sense of understanding that people really do appreciate what you're going through. It's, it's a safe place. It's a place where they're not judged. It's a place where people understand what it is they're going through. So, that is, and I love when you said, that kind of cross-pollination of ideas and understanding what support groups mean to organizations, family caregiver training programs, what that looks like. So again, there's the care in the center, which not minimizing at all. I mean, that's obviously a huge part of it, but it's kind of everything else, if that makes sense. Right. I mean, it's just all these other components that, are really almost the unexpected outcomes, but now expected.
Thank you to our Anatomy of Leadership sponsor, Dragonfly Health. Dragonfly Health is also the title sponsor for Leadership Immersion courses. Dragonfly Health is a leading care-at-home data, technology, and service platform. With a 20-year history, Dragonfly Health uses advanced technology and robust analytics to manage durable medical equipment and pharmaceutical services as part of a single efficient solution for caregivers, patients, and their families. The company serves millions of patients annually across all 50 states. Thank you, Dragonfly Health, for all the great work that you do.
That is so good. And what I love about that, it's been so interesting in the hospice industry. Whenever I joined in 1995, 75% were nonprofits, 25% for-profits. It is now flip-flopped. And no, not all for-profits are bad, but some of the scaling is like, remember that Henry Ford quote, you could have a Model T in any color as long as it's black. And I think sometimes franchises are kind of like, it's kind of that way, right? You can kind of have the one flavor. It's very, why do you love your local store? It's got so much variety and so much creativity.
Right.
And that's kind of what I feel like we've tried to do in the work we're doing in Teleos. These local hospices, there's some incredible uniqueness. So we're not trying to create cookie cutter Walmart hospices. And I'm getting the sense you're doing the same thing, which is interesting to call it a franchise, because I think that makes you a little bit of a unicorn franchise in some respects. Am I reading that wrong? Or
No, I appreciate that. And I certainly think that's Peter's vision as well. I mean, there's that local community that's in each one. So yes, the, kind of the design, if you will, kind of the experience that is Town Square and the use of reminiscence therapy, specifically immersive reminiscence therapy, that's certainly part of kind of the brand standard. But I think it's everything else, right? It's the local ownership. It's understanding where kind of the pain points of that community are. It's trying to figure out where, again, there's gaps. And so to your exact point, which was perfect, there really is an opportunity to create kind of that local impact and have kind of that creativity and innovation on their own with their teams in those locations, but still keep the best practices and those components of the franchise and the kind of the brand together. I mean, I think that's kind of, to me, the best of both worlds, because nobody wants to, necessarily open up a business and not feel like they're able to have that, autonomy to be able to help their local community. I appreciate that. But at the same time, take the best practices, not necessarily have to reinvent the wheel. I think that's a big component of, engaging with the franchise, is that you have all of those kind of core components, essentially already identified, and you have those as resources.
That is so well said. Man, we could do a whole nother podcast just doing a one chasing that rabbit, because there's an article in Harvard Business Review that I'm going to forward to you after this call. It's in my top 5 ever Harvard Business Review. I came in a hospice from industry, KPMG, Pete Merwick, or Fortune 50 company. So I kind of grew up in manufacturing during the time of the beginning of robotics and standardization and lean-based thinking, et cetera, Six Sigma. And so I fall into hospice, and these nurses are like, young man, this is all art. And I'm like, yeah, but, and because I was raised in process. And when I found this Harvard Business Review article, the title was When Process Becomes Art. It was like literally the skies opened, the angel sang, it came down on a little tablet to me. And I'm like, this is what I was looking for. And it reconciled what you're talking about. And the interesting thing is that's been really the road less traveled for organizations. I just got my first Tesla. I love my Tesla because I customized it to me.
Sure.
And so they have figured out the science of there's standardization and there's customization and there's art. And again, I knew I loved you the first time I met you, because my guess is we're kind of jiving on a lot of these concepts that are very unique, actually, especially in healthcare. I feel like some of our brothers and sisters in the health system realm are doubling down on you could have it in any color as long as it's black.
Right.
And there shouldn't be nothing that's more personalized in healthcare.
Absolutely.
And then the sacred ground that you're walking on with dementia care. So I'll get off my soapbox.
No, thank you, Chris. I appreciate it. And feelings mutual. And I mean, we share that passion for, obviously organizations, healthcare, and just that leadership component. And it's, I feel like there's just so much of that continues to be needed. And, and it really makes a difference, when you're talking about the impact in healthcare.
Well said. Well, definitely want to ask you a futuristic question. Then I want to get to some leadership questions, because I know that you and I just share that similar passion. So we know the dementia rates are going to continue to rise. Unfortunately, hopefully we will find that cure that you alluded to. But unfortunately, a lot of the statistics show that it's going to be more and more. So what do you see as that next frontier, like new technology, community integration? Like, what are those next things that you guys are thinking about that people could be looking forward to potentially?
Yeah, I think a lot. I think a lot of technology, is trending, we know, in a direction. I mean, certainly we know about the use of AI in so many things, but I think what it ends up being is, and you'd appreciate this, Chris, I like to refer to a lot of what we do at Glenner as high touch and low tech. So, I think you can't replace some of the components of kind of the humanistic piece. You still need individuals that understand individuals. You still need to be able to talk through things. But I do think that you can identify trends. And I'm also equally, as much as the gap guy, I'm also a little bit of a data junkie. And I like to see the data. And I think my team knows that I say all the time, numbers tell the story. It doesn't necessarily mean it's a good or a bad story. It just means that it tells a story. So I think when you're talking about use of things like the electronic health record and being able to essentially take information that clinical and social work staff put in. So for example, with GlennerCare, we developed our own EHR system. And so where we're going, because quite frankly, because I couldn't find anything that made sense for our space. And so again, a lot of great products out there, but just not what Scott was looking for. So where we're going, I think, and where Town Square franchising is going as well, is trying to create an opportunity for the use of documentation in like an electronic health record to be able to pull trends. So if you have certain clinical information that's put in, I think the use of technology and AI can analyze that, because it's taking all of this information of typically hundreds of individuals that we're serving, and also family caregivers, and being able to analyze that information to be able to create interventions, and ideally interventions that prevent certain events. Again, back to hospitalizations, emergency room visits, crisis for the family caregivers. So I think that's the biggest opportunity personally, is taking information that we're already gathering. But again, you can appreciate, Chris, if there's all this information there, then what do we do with it? Because you're not going to go through individual records. You have to be able to take certain benchmarks and then take that information and create almost like dashboards for staff to say, oh, there's an issue, there's something that's flagged. And I know some of that exists already, but I think we need to take more information that we're gathering from home and then gathering from our centers, or at least a place where care is provided, and have those things talk to each other. Because I know it's overused, but there's so much siloing that still goes on. So it's like, well, if we knew this, well, yeah, but we did know it, but it was in another system and we couldn't capture it. So systems have to talk together so that we can have better outcomes. I am a firm believer that we have the information. There's times when, there are, again, gaps where maybe information is not collected. For the most part, it is collected, but what do you do with the information?
Yeah. That's so good. I've started keeping stickies with incredible guests like you, and I start getting ideas. I have like 10 stickies in front of me right now just listening to you. So there's so much great stuff here. Well, I do want to get to the leadership part too. So you obviously lead an organization just founded on just deep compassion and innovation, which again, I feel like that's where you and I clicked so well the first time we met. How do you balance just honoring George Glenner's legacy while you push for new ideas and change? That's rare. Like some people just so venerate the past that they don't move forward. So talk about that.
Yeah, thank you for that, Chris. I mean, obviously, I never had a chance to meet Dr. Glenner, but I knew and spent so much time and years with Joy Glenner, who was a co-founder, and we just lost her recently, but she was not only an innovator, but she was incredibly motivated and passionate to support family caregivers. So, talk about sharing, kind of a passion. We shared that passion. So I think, my responsibility is to take those things from the legacy, right, and bring those to our team now, and assemble a team, as we talked about, that shares that same passion, but at the same time challenge individuals, especially when they're focused on one component. So for example, I have an education department, I have a social work department, I have a volunteer department, right? So I have all these departments, but it's bringing these leaders and asking them to not only do what they do best every day and run their department, but where are the opportunities? Where are the things that they can innovate? Where are, what is the community telling us? And what are the things that they're looking at that they see are missing? I think, and again, I know it's a cliche, Chris, and I've said a few of them, but the signs are everywhere. You just have to be able to see them. I mean, I've often said that, if you walk around a facility, you'll see things, right? That the staff may or may not have told you. But if you look at certain things, close enough, they'll tell you what needs to be addressed. right? They'll tell you what doors need to be open or unlocked, those kinds of things. So being observant, being intentional about trying to develop things, I think is absolutely critical to being able to balance the kind of the past and then bring things to the future. But really trying to challenge, the teams to make those strides, I think is the most critical component. And I like to say a lot that, CEO, very nice. I appreciate and respect my role, but it's really more about setting a vision. So I like, I know, Chris, you probably, come across, Simon Sinek, and he talks about being the chief vision officer. And I feel that. I very much feel that. And I want to help set a vision because I also know my team has a vision. So let's find those opportunities and make those things happen.
That's so good. Did I ever tell you the story about the Telias logo? Have I told you the story the first time we met? Again, I'm like, we're just so clicking here. One of my favorite authors is Jim Collins, and everybody remembers Good to Great, but the first book was Built to Last, or the one that became popular, I should say. And so if you remember, one of the core principles in that book, he said that organizations are built to last over decades. So think about your history, think about the history of the hospice as I'm working with 40, 50 years of history. One of the core principles was preserve the core, stimulate progress. And the actual, because he's so good of like visual words like hedgehog concept, right people on the bus, right seat in the Good to Great. Well, this one was a hurricane, all this change swirling about, and in the middle, there's a somewhat unchangeable core. But just like the eye of a hurricane, even that core can shift over time. And so it creates like this almost solar system with all this change kind of swirling about. So we believed in that so much. If you look in our TCN triangle, there's a swirl and then another triangle in the middle. And it even kind of like, it depends upon which one we use, it looks like it might move in the middle. And he was teaching a beautiful principle that you just articulated perfectly. And we believe so much in it, we put it in our logo. So.
Yeah, doesn't surprise me, Chris. I mean, that's when you have that passion, it really does fuel everything. So.
That is so good. Well, and another thing that just clicked the first time we met, you'd recently attended a conference I never heard about, but the title was like so intriguing, the Open Minds Conference. And so did a little bit of research, and apparently it showcases like cutting edge models in behavioral and cognitive care. And so coming out of that, like, did you get a lot of affirmation for your model, but do you also get new ideas? And did it challenge your thinking?
Well, it did, and I was so honored to be invited. So, Chris, the backstory, just super quick on Open Minds, we actually were very honored. As a San Diego State alumni, anything that I can do with SDSU, I'm all about. So, I was part of a few of organizations that helped to establish the Center for Excellence in Aging Longevity at San Diego State, which was led by a whole team, including the lead professor, Dr. Steve Hornberger. So he was the one that invited me to Open Minds because they actually helped create a whole track within that conference. And so my opportunity there was to talk about partnerships in community and again, gaps, go figure, in communities and where organizations can, better connect. And so I was on a panel with several colleagues, some that I knew and some that I had just met. And we had this incredible conversation, because which you would have loved, which we just talked about, how organizations can come together and work closer, together by just talking. Just sitting down and sharing, and even in that hour presentation, so many ideas happen, so many discussions points happen, and it was a lot of like, wow, we didn't realize you were doing that. Oh, okay, well, let's talk about that. Exchanging numbers after. So I know, like we were talking about technology, and there's so many wonderful things to do with technology, but there is still, this huge, and it worries me a little bit, right? Because people need to sit down and talk. They need to network. They need to engage. They need to figure out, I know things are easy. You can search anything and find anything. But the reality is that most of these relationships, it's still very old school in developing those relationships. So I actually walked away more with that than anything else, of just how important it is to keep conversations going and identify partners within your community.
That's profound for you to say that, given the type of conference it is. And I, like you, have a lot of interesting, I'm a huge utilizer of AI, also a little concerned about what it means when you think you've mastered a subject, when you just hit a chat GPT and you read it and go, now I'm a nurse. I just did the chat GPT thing. No, I'm sorry. There's something you can't replace with years of experience.
Yes.
I think it's going to be a very interesting time of that gap between reading something and true understanding of something is going to be an interesting kind of path as we go forward in the future. But I imagine it, as far as like models, right? Since it was kind of about cognitive care, behavioral care, was there any like future innovations or things of like, that's interesting. So we're going to think about something we're doing differently?
Well, I mean, definitely conversations. There was a managed care plan there on the panel, and talking about the ways that they analyze data and ways that they're using that information to identify partners, right? So this was a real telling part of the discussion because, again, when you're able to show evidence-based outcomes, and we know that another one of those terms that's used a lot in healthcare, but it really matters, right? I mean, we know already that, many consumers are making decisions really just based on, quite frankly, surveys and, inspections, right? So we know that there are enough decisions being made in healthcare that are just based on, I say objective information, but then there's this whole component of just trying to figure out how we can use the data to really show some of the, and I'll say it like we talked about before, Chris, the financial outcomes as well, because a lot of these, organizations are looking to how to maximize dollars. They have, it's population health, it's managed care, and I understand it and respect it. I think we all do, but you have to be able to use information to be able to go back to these partners and say, let me show you what these outcomes look like. Let me show you what we're able to do. It's in my opinion, Chris, it's not enough to just have a service. You actually have to be able to show what those outcomes of those services are. I think that, if you respectfully, if you don't have that within your organization, you're going to miss a lot of opportunities because people are, leaders are looking for that.
That's really good. The other thing I wanted to ask you about we talked about this earlier, the town square concept and the 1950s style environment. Did anything kind of push your thinking from this conference on that? And maybe I could ask it a little bit better. It never occurred to me when, with the math behind that, like your best memories in the 30s. And then, of course, probably facilities. I don't know this as well as you, but there's probably some rhythm of updating that you have to do. I mean, you managed facilities in the past, right? As a nursing home administrator, one of the first things typically you have to do is refresh the physical plan of the facility. So does your interior designer have a really easy job because you go from the 50s to the 60s to the 70s?
Pretty much.
Every 10 years?
Yeah, I mean, that's exactly right. I mean, I think, a couple components there. I mean, yes, on the design, we've had lots of conversations really about when do we go from, the 50s music and then push more into the Beatles in the 60s? And then, when does it become Pink Floyd, in the 70s and those kinds of things, right? So, I mean, it's definitely a discussion that we're having. But I think, interestingly enough, and I'm really proud of this, Chris. I think, yes, it's 50s and 60s design. And again, some of those things are timeless, right? I mean, a diner is going to survive all the decades, right? We people still love going to diners, and I mean, those again are rather timeless. But I think it's, what's really interesting and what we've taken away, and we see this in a lot of the conferences, including Open Minds, is trying to figure out ways to capture all the diversity that's out there. And obviously there's such a wonderful diversity in our country, and it's one of the things that makes our country amazing is having that diversity. And so here in San Diego, and actually in Chula Vista, which is really incredibly close to the border, right? I have many staff members that travel from Tijuana to work in our location in Chula Vista. So how do we capture all of those cultural components and capture that diversity in our centers? And I think we do it by programming. We create specific activities and programming. I think there's a full opportunity in the future to take more technology to be able to share and even have those programs that we have in the centers be able to be transferred, if you will, or adaptable to home, so that family caregivers can use some of that programming at home as well. It goes back to the upskilling of family caregivers. So I think for me, it's all about using all of the components that we've talked about today, whether it's technology, whether it's leaning into the diversity, whether it's figuring out ways to show how the outcomes really impact what we're doing. But it's not just one thing, it's all of those things.
That's so cool. Well, when I was doing the research on Open Minds, I noticed sustainability is a big word that they use. We talk about no margin, no mission all the time. That came from the wonderful nuns in healthcare, Catholic health systems. So balancing mission and margin, how do you keep the Glenner model financially viable, but still maintaining that high quality? How do you bring that into leadership with your staff?
I mean, I'm not going to be, soft about this, because it's tough. It's, things are expensive. Things keep getting more and more expensive. Quite frankly, the cost of talent is expensive, and I'm all about making sure that we're paying not only a livable wage, but a professional wage to our staff. I mean, wanting to see people make a profession out of the work that we do, not just, a stepping stone, or just like, hey, this is kind of an entry level. And these are professionals. These are individuals that are taking care of people with arguably one of the most difficult, diseases, to manage, again, on the planet. So leaning into all of that, I think what I like to say is, this is our call to action, right? If we're going to keep things affordable and keep things accessible to family caregivers, we need support. We need donors and grantors to see what we're doing. It again, back to the gap, it covers the gap between what it actually costs to take care of a participant in one of our centers or a member, versus, what we're actually charging. Again, I think no matter if it's a for-profit or a nonprofit, I mean, like you said, Chris, no margin, no mission. You have to be able to cover the expenses. So I think that's how kind of I approach it from a balancing standpoint is, again, challenging the team, because we're always going to be, it's not a negotiable item to have anything other than quality outcomes. I mean, that's the expectation. And I like to say, satisfactory is not an acceptable outcome. I mean, we want to exceed expectations every day. So that's the story, if you will. And I, like you, Chris, I mean, I think, you have to be a strong storyteller to be, leading an organization, and I think that's one of the biggest, joys in my career, is being able to share the story that is the Glenner Centers, that is Town Square and the franchising evolution, but and hopefully seeing, this model inspire individuals to tell their own story of what makes a difference in their community.
Good employers know that health benefits can make or break your business. But while employers are looking out for their employees' best interest, who is looking out for theirs? Sona Benefits is an independent pharmacy benefit manager who partners with employers to optimize their pharmacy benefits while supporting their business goals. But by offering no-spread pricing, contract guaranteed rebates, and the Sona Max program, clients are regularly able to save 20% to 35% off their total drug spend. The result? Pharmacy benefits that improve employees' well-being and employers' bottom line.
That's so good. The first time we met, one thing, it was almost a passing comment, but I wrote it down because, again, there's so many places you and I click. But you mentioned, this is the gist of what I remember your comment, so you could correct it if maybe I remembered it wrong. But you said, there's so much synergy left on the table in healthcare because organizations compete instead of collaborate. That just hit me like a lightning bolt. And we believe in collaboration. We put it in our name, Teleos Collaborative Network. So why do you think collaboration is so rare in healthcare? And what do you think it's going to take for us to shift that dynamic?
Well, and I thank you, Chris, because I mean, you model it, and I think that's what you do with your organization and the synergies that you're after. I mean, again, like you said, I mean, that's why we've absolutely clicked, because we share that. And I just think it's going to take more dialogues. And I know I referenced that earlier, but I think it's going to take finding an opportunities for people to really understand that, competition, while I do get it. Like, I understand that, that is part of, business 101. more than anything, organizations can support each other, and there is plenty left to do. And I think that's what strikes me every day. You were alluding to the numbers earlier. I mean, we know that, the millions of individuals, right, that have dementia, and those numbers are only going to increase. And by the way, Chris, and this, it's not just Alzheimer's disease, right? It's Lewy body dementia, it's frontal temporal, it's vascular, it's CTE. I mean, so to sit there and think that organizations can't find synergies, I'm going to push back on that every time, because it really shouldn't be about competition. And again, at the very least, there's enough business to go around for everybody. So, I think if we can just step back for a second and just understand that, and really, and again, I think it's a matter of figuring out how to bring people to the table and have those discussions, because we get it. Everybody's so busy. Everybody's trying to, there's demands on times and 100 emails every day and all these things. But the reality is that if this is, to me, what really matters is having these meaningful, intentional conversations to build communities that will really transform healthcare. Otherwise, we already know we're just going to keep going in a direction where there are going to be people left behind. And that's, I think, what drives me every day is, I've said this many times, I think I could work every day for the rest of my career, and I don't think we'd even scratch the surface of what's needed in dementia care. And that's just one component of healthcare.
Yeah, that is so incredibly well said. I'm going to get this wrong because I don't remember the specifics. There used to be a training video. I think it was in Seattle. Like the Seattle fish market, I think now is famous.
Mm-hmm.
I may have this wrong, but I think like originally it started where they set up like this fish stand, almost like as a public area in front of someone's shop. And it was like, that's competition. And then, they just changed their whole mindset. And then it became this beautiful ecosystem of like an open air market. Again, I may not have the specifics right, but that was at least a learning lesson that stuck in my mind. That's what comes to me listening to you. It's the challenges are almost feel insurmountable in healthcare. And so instead of the competition, and I get it, the financial pressures are immense, and that's where people want to retreat back. But quite often the historical pivots of breakthroughs are thinking differently than everybody else. I think you nailed it with that. It is getting away from that competitive mindset, that more open, collaborative mindset, getting away from that scarcity mentality to more, as Stephen Covey said many years ago, that abundance mentality. I really think you're onto something with that.
Thank you, Chris. Well, and by the way, I think you got that story exactly right. It is a perfect example, and you see it. Yeah, I think I told you before. I think you see things like the Matrix. I think you see it very clearly, and so and I aspire to that as well, because I think when you can step back and see things like that, I think you just see that this it's an incredible mountain to climb, but we're all on the same mountain. So let's just kind of help each other, scale that mountain so we can help more people. Isn't it? And I know it's kind of a rhetorical question, and I try to say it, to my team, but it's really just about helping people. Everything else really comes together if you're doing things the right way. At least that's why I got into it.
That's so well said. Actually, I have it on a big sticky right in where my big Zoom room is every day is how can I help? Every day, just how can I help? And gosh, if more of us did that, we would actually really make a difference in this healthcare thing.
Well, you're doing it, Chris. And I'm so thankful to have this conversation with you, because I'm hopeful that your listeners, take anything away from it. I'm sure they do when they.
You're inspiring me, so I think I know you're inspiring them. So last couple of questions. Your staff, you alluded to this. They do just emotionally intense work every day. What leadership practices help you sustain that purpose and the morale of your team?
Well, I think, I have some core ones that I've used forever, which I think, again, you'd appreciate, Chris. Like I use something that I developed years ago just called EAC, which is expectations, accountability, and consistency. So I feel like it's a tripod. And if you don't set expectations for people, then, they struggle. If you don't hold people accountable, they struggle. And if you're not consistent with holding people accountable and setting expectations, they struggle. And so I use that kind of core leadership principle pretty much every day of my career, because I try to inspire my team where I can to kind of diagnose when there's an issue. Again, did you set the expectations? Were you holding the individual accountable? Were you consistent? And again, that's just kind of the nuts and bolts of running an operation. But then it's the things like we talked about earlier, which is really, and I'm a big fan, Chris. I don't even have to ask you. I know you've come across, but Marcus Buckingham and First Break All the Rules, and we talk about those questions all the time. Are you doing what you do best every day? So those are those guiding principles that I want to make sure that we're bringing the right people into the organization, that we're, not only driving our mission, but also our core values. So we don't use those things as just, respectfully something on the wall somewhere. We actually, live those components. And so that's a big part of the, kind of leadership philosophy I have is we don't need to, develop a whole bunch of other things when we have tools kind of at our disposal that are there to guide us.
That's so good. You'll laugh. When I was young and I didn't have gray hair, I got back from a conference and we had an all-staff meeting, and I was all excited because I forgot what it was at the time. I think maybe the purple cow or something like that. And a staff member said out loud, "Oh, great. What is he going to have us do now?" And I just, thank God I was somewhat wise enough to go, that's not a compliment. There's something there. And it began a really good part for me to go, okay, you can't be that flavor of the month guy. You got to bring good principles.
Absolutely.
So it was one of those catalytic moments in my career. And I feel like luckily you learned it probably at a much younger age than I did.
Well, just as a quick follow-up, Chris, one other thing, I have a quarterly leadership meeting with my team, and I tell them all the time, I'm not here to try to play school with you. I actually want to bring things that are valuable for you to use, in your day to day. Again, I'm trying to invite that feedback, and I have plenty of things, as you've heard today, that I use as, kind of philosophies that I've picked up along the way. But I do like and love that saying, tell me what, I need to know, not what you think I want to hear, So if there's not something that's valuable, let's talk about it. We're colleagues, we're professionals. Yeah. At the end of the day, I have to make certain decisions, but this is a team, and a team that's designed to, have an impact. So let's have an open dialogue about those. And I think that's been a theme of what you and I have talked today. Like when communication breaks down in any of these things, that's where the real problems are.
Yeah, well said. Scott, we could go on hours.
For sure.
I want to give you the final thoughts.
I think the final thoughts for me, Chris, are just, this is a big journey, that we're all on. And, as I was thinking about this question, coming on your show, I was thinking, if anything now, it's really about, bringing individuals into healthcare that really want to make a difference. And again, I know it's rather cliche, but I think for me, as I'm trying to talk with, the younger generation, there's lots of ways to make money in this world, but when you can really have an impact on somebody's life, and especially when we're talking about family caregivers and individuals that, are on a journey that they didn't expect to be on, trying to figure out ways that can really make a difference for them. I think it's not only what it does for you professionally, but it's, again, what it does for the entire kind of community of healthcare. And I think the more times that we can bring people in that really drive that, it will make the difference. And I know it's still a big mountain to climb, as we mentioned, but I'm very inspired by what I see in healthcare. And I just think that these kinds of conversations and, the individuals that are listening, they can go back and they can really take this, synthesize it and put it into motion. Like, you can make a difference. And I know that, some people still need to hear that because, it can feel like a big challenge, but at the same time, those challenges can really drive a success and really make a difference where other people might have thought they couldn't.
That is so good, Scott. Well, I want to thank you and what your team is doing. It's incredible. Scott, anything you want us to include, like your email, if they want to learn more about the Glenda model, if they want to learn more about your town square model, I want to make sure we have all those links. We'll put those in the show notes so people can easily reach you guys. Again, tell your team thank you. Thank you for them sharing you with us for this little bit of time. And just again, thank you.
Oh, absolutely. And easy to find us, Chris. We're at glenner.org. So just GLENNER.org. So everything you'd probably want to know about Glenner is there. And I'm happy to be a resource to anybody that would like to reach out. And Chris, thank you. Thank you for the opportunity. I really I love talking with you.
You bet. You as well. Well, to our listeners, we thank you. At the end of each episode, we always share a quote, a visual. The idea is going to create a brain bookmark, a thought prouder about our podcast subject. This one's going to be a fun one to have the perfect brain bookmark. So the idea is we want to further your learning, your growth, and thereby your leadership. We're hoping for it to stick. Again, the idea of like a brain tattoo. Be sure to subscribe to our channels, The Anatomy of Leadership, TCN Talks. We don't want you to miss an episode. If you're interested, you can check out the book, The Anatomy of Leadership. It's on Amazon. Tell your friends, your coworkers about this podcast. We do this in service of you, so you can learn about great organizations and the work that Scott and his team are doing. So thanks for listening to The Anatomy of Leadership. And here's our brain bookmark to close today's show.
Expectations, Accountability, and Consistency by Scott Tarde. Preserve the Core. Stimulate Progress by Jim Collins.